Welcome back to Fox 10 News at 4. You know, deciding when to see a spine surgeon for a possible back surgery, that's a big decision. USA Health helps patients with back pain at the Complex Spine Center. And so I have one of the experts, Dr. Richard Menger, the chief of Complex Spine Surgery at USA Health. He's in the studio to talk more about the services offered there. I guess I want to start first with, why would a person, or what would get a person to have the need to see you? What happens that causes back pain?
Yeah, so back pain is one of the most common reasons that people miss work, disrupts their quality of life, and you know, thankfully most of it can be solved with conservative therapy. Doesn't need surgery, and a lot of that pain is musculoskeletal pain. So seeing a physical therapist or seeing a conservative sort of treatment protocol can really help with that.
One of the things that you just said there was injury, and I really want to touch on that because people can cause themselves long-term damage just by not lifting something properly.
Yeah, it's definitely a lot of you know, how you treat your body, how you take care of your body over time. And that's part of the things we work with, and we're sort of building protocols at the Complex Spine Center. The idea is that it's very interdisciplinary, that the surgeons work together with the physical therapists and our colleagues in the pain department and the whole sort of gamut of experts that we have at South to help people sort of, you know, take the best care of their body and have the best possible outcomes if they ever need surgery.
So on that note, talk about the types of cases that you guys treat.
Sure. So we kind of focus on the whole gamut of spine surgery. So we perform minimally invasive spine surgery. The patients can leave the hospital the same day or the next day with a very small incision that almost a Band-Aid can cover. And then we also do the more complex spine reconstructions where we fix people with large curvature to their spine and fix a true spinal deformity.
Wow. Okay, so what role does USA play, I guess, in also being an academic medical center with all of this?
Yeah, so the USA has the academic footprint where they push and drive and innovate the field. And for us, that means sort of tackling the most complex cases. And then, you know, it's not the kind of thing where a doctor goes home at 5 o'clock and you know, doesn't think about the case. We're there sort of pushing and driving the field, and not just sort of reading the literature, the scientific papers, but kind of writing them and pushing the field forward and being sort of on that cutting edge.
Yeah. On that note, there's just constantly, there's new information coming out in terms of different ways that you can be treated. How do you stay on top of it all?
Yeah, so you read the journals that are in our different fields of scientific literature, and then you have to step out of exactly the surgeon's role and see what your colleagues are doing in physical therapy, see what they're doing in sort of pain management protocols with the opioid crisis going on, and just finding the best way that you can treat your patients. So.
Wow, it's a balance.
Yeah.
Well, thank you so much for stopping by and talking about the services offered there. And we're going to post this interview for you on our Fox 10 News YouTube page. Look for it shortly and be sure to subscribe.